And we are kicking things off by giving Mayor Lori Lightfoot her second dose of COVID vaccine. So anything you'd like to say just while I get ready?
Just make sure you aim correctly.
Can't even see where it went in. Any comments?
No, I mean, it was just, it's a little bit of a pinprick. Feels like when you get your flu shot, but so far so good. I'll stay here for my required 15 minutes and then we'll get on with the press conference. But, you know, look, I'll say that more when we have the formal remarks. This is truly life-saving. I've now been at probably a half dozen of these events, and particularly poignant for me watching the healthcare workers early on get their vaccine, and you feel this sense of relief in them that they've been putting themselves on the front lines. And this is true of so many workers that have been out there who haven't had the luxury of staying home and get this life-saving vaccine. It is absolutely safe. I want to make sure that we keep reiterating that. We educate and bring people into contact with healthcare providers and whatever other way, but we've got to get people to take this vaccine. This is the way that we will get our lives and our city back to normal. The vaccine is so important to the health and well-being of our city. I'm encouraged by really the uptake and the number of people that have gotten a vaccine, and it's through the hard work of a lot of folks across the city, not just starting with the vaccine, but really from the very beginning of COVID-19 coming to our city. Dr. Artie and her colleagues at the Chicago Department of Public Health are partners all across this city, like Esperanza and other federally qualified healthcare centers, and a number of community leaders have been building to this moment, and it's on the basis of those partnerships, trusted tables that have been set in neighborhoods all across the city, particularly those that have been hardest hit by COVID-19, that this moment and others like it on our long journey are possible. So I'm grateful to all who have been part of this hard but incredibly essential work that has laid the foundation for, I think, a rejuvenation of our community health network across the city, and more to come. So thank you.
All right, thank you. Okay, so we're going to move down and vaccinate a few other people while the mayor is doing the 15 minutes. Whether it's post a first dose or a second dose, we always have that 15-minute waiting period. We don't anticipate any issues, but in case anybody were to have an allergic reaction, we're completely ready in case of this. So who do we have doing the vaccinating?
My name is Armando Ambriz, medical assistant here at Esperanza Health Centers.
All right, great. And who's getting vaccinated?
Hi, everybody. I'm Jada Johnson, and I'm actually from the Vaccination Operations Center.
All right, wonderful. And the Vaccination Operations Center is really one of the city of Chicago's larger mass vaccination sites. So, yep, no worries.
It really did not hurt. I thought that was a joke. It really does not hurt, guys. Not even a pinch. That's an overstatement.
All right, great. And moving on, I'll come behind here. Okay, so who do we have vaccinating?
Oh, my name is Shay, and I'm a nurse practitioner with Esperanza.
All right, wonderful. And who's getting vaccinated? ¿Cómo se llama?
My name is Veronica Figueroa.
Okay.
I work for SWAP.
You work for SWAP? Okay, perfect. I know.
It's fine.
All right. Any comments?
No, everything is fine.
All right, good. All right, and our last group for today, we'll let people move down. So who is doing the vaccinating?
So I am Elsie. I'm a nurse practitioner and I work for Esperanza.
Okay, great. And who's getting vaccinated? ¿Cómo se llama?
Berta Abina.
With SWAP?
Vengo con SWAP.
Okay, perfect. And SWAP is the Southwest Organizing Project. All right. Great. Any comments? ¿Todo está
Todo
bien?
está bien. Sí.
Okay. Muy bien. Thank you. Congrats. Thank you. Congrats. Congrats. Good job.
One, two, mic check. Microphone check, one, two.
Morning, everyone, and thank you all for being here. Let me begin by recognizing and thanking the leaders and organizations here with us who have been instrumental in making this moment possible. Of course, Chicago Department of Public Health Commissioner Dr. Allison Arwoody, Chicago Community Trust President and CEO Dr. Helene Gale, Esperanza CEO Dan Fullwire, and Ms. Alita, who is a parent mentor of 3 local schools. The Loretto Hospital President and CEO, George Miller, who's grateful these days that he's in Chicago and not in Texas. I had to say it, George. And of course, Alderman Stephanie Coleman, in whose ward we are in today. And members of the Southwest Organizing Project and COVID Response Corps, who have been working tirelessly on outreach efforts over these past several months as part of our Racial Equity Rapid Response Team. Thank you so much to all of you for joining us here today. We are here to announce some exciting news about an important breakthrough in our vaccine equity distribution efforts. Just over 2 months ago, we finally began to see the light at the end of a long, dark tunnel we've been in since COVID-19 first came to our city. This light came in the form of long-awaited vaccines. And while it gave us a glimpse of what a post-COVID Chicago could look like, it also illuminated the significant challenges that we have struggled with throughout this pandemic. Less than a month ago, I came before our city to share our early vaccination distribution data, which I and others found deeply disturbing. And at that time, despite Black and Latinx residents making up 59% of our city's population, only 18% of vaccines went to Black and Latinx residents during our first week of vaccinations, a time when vaccines were only available to healthcare workers and vaccine eligibility was limited to employment status. These early results were a reminder that equity must be at the heart of our vaccine strategy, or else outcomes will quickly disadvantage those most burdened by COVID-19. And as I've said many times before, equity isn't just part of our COVID-19 strategy. Equity is our COVID-19 strategy. That's why as soon as we saw these numbers, we doubled down even harder on our efforts to drive these life-saving vaccines into communities that need them most, and ensure vaccination rates among residents of all races and ethnicities match the demographics of our city. And now, I am thrilled to stand before you today to update you on our progress. And let me remind you, again, during our first week of vaccine distribution, only 18% of vaccines went to Black and Latinx residents, despite Black and Latinx residents making up 59% of our city. We knew before we received those first doses of vaccine that vaccine hesitancy, particularly among people of color, would be a significant challenge, and it has been. But now, in the most recent week of COVID-19 vaccination in Chicago, with vaccines available to people 65 years of age and over, and frontline essential workers, and our Protect Chicago Plus equity strategies in place, I'm very pleased and excited to announce that 50% of COVID-19 vaccines went to Black and Latinx residents. You can cheer for that. 50%, folks, a percentage that is nearly 3 times that which we saw less than a month ago, and a percentage that already will be looking at one of the best equity vaccine distribution numbers in the entire country. Now, we still have a long way to go, but this incredible progress is a direct result of our equity-based approach to responding to COVID-19 since day one, which we have carried forward throughout our vaccination strategy. This is a strategy that started with launching our Racial Equity Rapid Response Team back in April of 2020. And we said at that time, we did not want to build any temporary scaffolding. We wanted to build a foundation that would carry us through the pandemic and onward so that we could build up our ability as a city to shrink health inequities and make sure that everyone had access to good quality health care, regardless of their financial status, regardless of their zip code or background. And that is precisely what we are doing. And the progress that we've made, that we are announcing today, is a direct result of that strategy and that hard work that started back in April of 2020. Our racial equity rapid response team, let me remind you, brought together community health care, faith community, and other stakeholders to build trust and connect residents to the care that they needed so that they could get treatment that would be life-saving in the face of this terrible pandemic. This strategy also ensured that our federally qualified healthcare centers, like Esperanza, receive vaccine directly and increasingly over time. This is a strategy that involved partnering with, for example, SIU Healthcare and others to ensure that essential workers who are less connected to big employers still had access to city distribution of vaccines. This is a strategy that involves partnering with faith leaders and advocates to ensure that our residents get accurate information so that they are ready to be vaccinated when it is their turn. This is a strategy that includes initiatives such as Protect Chicago Plus, which targets 15 of our highest need communities to ensure those residents have no barriers to access to get the life-saving vaccine that they need that are going to transform their lives and put them on a return to normalcy and recovery. Over the past year, the Racial Equity Rapid Response Team has been integral to our ability to deploy resources to our highest need communities over the past year, such as Gage Park neighborhood that we're in right now. And since vaccines first arrived in our city, the team has been working tirelessly around the clock, deploying representatives from our outreach teams to literally go door to door and be present in high traffic areas such as grocery stores and laundromats to share information and assist with appointment scheduling. We made a commitment, which we are following through on, that nothing would stand in the way of people in need in these 15 communities getting the vaccine. We are kicking down doors. We are breaking silos to make sure that we bring people into facilities like Esperanza and other pop-ups that we are setting up to get the life-saving vaccine. As many of you are aware, lower rates of vaccination among Black and Latinx residents aren't driven just by a lack of access to the vaccine. They're also driven by a reluctance to take the vaccine, a reluctance that stems from deep distrust in our government and healthcare systems because of the historic role that we've played in perpetuating systemic racism, inequity, and injustice. We all know that this is a truth, but we must do more to break through it. What I also know to be a truth is that Black and Latinx residents are getting sicker and dying at higher rates. And that can't be acceptable to anyone, and it certainly isn't acceptable to me as mayor. So I and we have all committed to making sure that we do whatever is possible to bring these people life-saving vaccines in and make sure that we are reaching our most vulnerable residents. It's my responsibility as mayor to implore all of our residents, every single one of you, those who are listening, those who are scared, those who are still nervous and have hesitancy, to tell you the vaccine is safe, it will save your life, it will save the life of someone that you love in your family, in your friend network. Please, everyone, educate yourself and get to a vaccine. And I won't stop until we maximize the opportunity to get every resident who wants a vaccine to be able to get one in their neighborhood through a trusted provider. Now, all too often, those who have the most severe underlying conditions are the ones who are the most hesitant to get the vaccine. And we certainly understand that. But even with you, please educate yourself. talk to somebody in your network. We're now increasing the numbers of people who are getting vaccinated across our city every single day. I guarantee you there's somebody that you know who has at least gotten their first dose, if not their second dose, and they can give testimony to the fact that this vaccine is safe and it's given them a relief that comes with feeling like you are inoculated against this terrible virus. So today's announcement that 50% of the people vaccinated last week were people of color is truly remarkable progress, and I'm confident that that number will only continue to grow. It tells me that all of the outreach and education is finally breaking through. We will certainly not rest on our laurels, but this is another important milestone in the long journey that we have been on out of the darkness into the light and onto a better tomorrow for every resident in our city. More work to be done, but I am extraordinarily grateful, proud, and relieved that all of our efforts that we have made are breaking through, and I commit to you that we will continue to do more as we continue to lean in to the trusted partnerships and infrastructure that we have built across this city to make sure that equity is real for our residents. And with that, I will invite Dr. Arwady to come to the podium to provide some additional words about today's announcement. Dr. Arwady.
Thank you, Mayor. We are really excited to be announcing this progress in our equity goals. As you all know, we set efficiency goals and equity goals when it came to our vaccine plans. Every single week since the vaccine rollout began here in Chicago, we set a goal that 95% of the vaccine Chicago received would be pushed out the door to providers. We have met that goal every single week. The most recent week, 96% went out. We hold a little bit back to make sure people can get those second doses on time. Secondly, we have been tracking our vaccines actually getting into arms. We ask 7 days after vaccine has been delivered, has it been administered and reported, meaning the computers are talking to each other. We set a goal there of 85% of all of that vaccine into arms and reported 7 days later. Not only have we hit that, last week in the same week that we hit that equity mark for the first time of 50% of our vaccine going to Black and Latinx residents, that same week we hit 100% of our doses going into arms 7 days after arrival. Thank you. We set aside the amount that is going to our long-term care facilities, but even including that group, because that progress is still happening through February and March, we're at 86%. So we're hitting and exceeding all of our efficiency goals. But we weren't happy just to announce efficiency goals. We've been working on this equity strategy, not just since the vaccine launched, but since long before. We launched Protect Chicago at the beginning of our second surge in October. That's before we had vaccine, but that was recognizing that we needed to do more with so many of our partners like Esperanza, partners like SWAP, the aldermen, there's partners like hospitals, and so many others who have work to make sure that people in Chicago have access to the things they need to get themselves and their families past COVID. So before we had the vaccine, there were people knocking on more than 400,000 doors in Chicago here, making sure people had access to testing, information, getting people the resources that they needed. And then once the vaccine launched, at the beginning, as you heard, we were very employer focused. We couldn't do as much related to equity, although we did work to make sure, for example, every single one of our hospitals, large, small, safety net, specialty, all started to get vaccine the first week. We supplied continuously to our healthcare providers, but we were working toward 1B. We are now less than a month into launching 1B. I know this because the mayor has just gotten her second dose of vaccine. And with less than a month into 1B, we've managed to move the needle without sacrificing efficiency on equity. We are not done, but there's other good news. Because while we have been working to push vaccine into the settings where it is most needed, whether that's those long-term care facilities, into the jails, into the homeless shelters, the settings that we have seen so disproportionate number of cases, and moving now into some of the communities that have most borne the burden of COVID cases, hospitalizations, and deaths. Pushing the vaccine in that way is not just the right thing to do for equity, it is also the thing that lowers everybody's risk for COVID in Chicago. We are already seeing decreases in cases out of those settings, even while vaccination continues. And so I'm also happy to say that today, in the city of Chicago, we are averaging just 323 new COVID cases per day. That is down from more than 3,000 a day. Thank you. Down from more than 3,000 a day just at the peak a few months ago, and below that 400 per day cutoff that really marks our high risk area. We want to get down below 200 cases and keep going from there, but just in the last week, down 29%. And that's not just the snowstorm, because testing is down just 6% and cases dropping 29%. I'm also happy to announce today we are at a 3.5% positivity in the city of Chicago. For those of you, yes, that we definitely applaud. That is the lowest positivity that the city of Chicago has seen from COVID since COVID came to Chicago. Over the summer, we'd gotten down under 4%, but never this low. And this kind of progress has come because we have been doing the things that work here in Chicago. Wearing the masks, socially distancing, not taking unnecessary risks. And we need people to keep doing this. We will continue to push vaccine to the settings where it is most needed. And again, you're hearing from me, everybody in the city of Chicago is going to have access to vaccine free of cost over these next few months. Since 1B launched, we've been getting, the amount of vaccine we've been getting has increased. We were getting less than 5,000 first doses per day 4 weeks ago. We've seen that go up a bit each week, 5,700, 6,000. The current week we're in, we're getting 6,900 first doses. And next week we'll get even more. We're going to be over 8,000 doses per day for the first time. And I'm really excited that one of the additions that we are getting is the federal government, somewhat in conversation with places like Chicago, that started providing vaccine to places like federally qualified health centers and to outpatient providers right at the beginning when we were able to expand in 1B. The federal government is now also starting to direct vaccine to federally qualified health centers, separate from the allocation that we are already receiving in Chicago. So over the next couple of weeks, Esperanza, as well as the University of Illinois, Erie, Access, and Heartland Alliance. We've got more than 40 federally qualified health centers that will be receiving an additional 100 doses per week on top of what Chicago's getting. We think that's important. We know this is some of the best strategies for getting vaccine to the people who most need it. And as our vaccine grows, we can handle it. We have more than 525 providers enrolled, ready to get vaccine. We're just waiting for vaccine. The amount of vaccine that we've gotten only covers less than a quarter of all of the people who are eligible in phase 1B. So I'm proud to say that 1 in 10 Chicago residents has gotten at least that first dose of vaccine, and 1 in 4 Chicago residents over 65 has gotten at least that first dose. As more vaccine gets here, we can roll up as quickly as we can, keeping always efficiency and equity at the center of our planning. It's the right thing to do, and it's what helps Chicago get past COVID. And with that, I'm really pleased to bring up Dan Fulweiler, the CEO at Esperanza Health.
Thank you, Dr. Arwady, and thank you, Mayor Lightfoot, for being here with us today. It is a great honor to have you. And I just wanted to let you know that today is a regular clinic day at Esperanza, so I really want to thank all of our patients who are here with you today, getting their vaccines and coming through just as though it were a normal day at our vaccination site. We were incredibly proud to open this vaccination site just over a week ago under very rapid circumstances, which is, I think, the way that everything is happening during this pandemic. It's rush rush to do the right thing. And I want to thank the mayor and the city especially for all of the work that they have been doing really on the health equity front. I would also say, though, that we at Esperanza, and I think all of the FQHCs and our partner organizations, are putting a challenge out there to you. Because health equity isn't just achieving equality, it's going above it. And Dr. Arwady is nodding because she knows that very well. What that really means is that the least among us need the most support from us. And we at Esperanza, at SWAP, at GPLXC, we are here to help you in that endeavor, and we're going to push you, too, so that you follow through on your commitments. And we appreciate your commitment to that. So thank you for being with us today. Unas palabras en español, por favor. Nos da mucho gusto estar aquí con todos ustedes hoy día y con todos los pacientes que están aquí con nosotros también. Estamos orgullosos de tener la alcaldesa Lightfoot aquí para ver cómo está este centro de vacunación del suroeste de Chicago. Y nos da mucho gusto que todos los pacientes que pueden estar con nosotros también. Estamos súper contentos que ya tenemos más vacuna para esta comunidad que necesita tanto esto para rescatarnos de todos los problemas que hemos tenido en el último año. Esta enfermedad nos ha hecho mucho daño a nuestras familias, a nuestras escuelas, a nuestros negocios y a nuestra comunidad. Esto ya estamos por fin empezando a ver la luz al final del túnel. Y nos da mucho gusto en Esperanza estar con todos ustedes para ver esa luz. También queremos agradecer a SWAP, a GPLXC, a todas nuestras parejas en la comunidad que están ayudando a informar a toda la gente de esta comunidad de qué tan seguro es esta vacuna. Le va a salvar la vida a usted y a sus familias. Y eso me emociona, pues. With that, con eso voy a presentar a Elidet Hernández. Elidet es una mentor de los padres de 3 escuelas aquí en la comunidad. Es una héroe personal para mí y para toda la comunidad. With that, I want to introduce Elidet Hernández. She is a parent mentor at 3 neighborhood schools where she organizes parents to make sure that they can bring everything to the classroom that our children really need. She's a personal hero of mine, and I know she's a hero to a lot of people in the community, and she wants to say a few words.
Your safety.
Gracias.
Thank you. Good morning, everyone. My name is Elidet Hernandez. I'm a leader with SWAP, and I've been living in the community for a long time. My neighborhood, my home, Gage Park. I want to say thank you to our mayor and Dr. Audi and Alderman Coleman. I've been part of the Parent Mentor program since 2009. I see myself growing in both ways, personally and professionally. I also see leaders in the community and the institutions we work with start working together with all the community. This has shown me that when we work together, we are stronger. We are working hard to build a strong relationship with the schools and with the partners of the Southwest system of care, such as Esperanza Health Centers. In a short time, we have been seeing impact on the families of the community of Gage Park. I have seen families start developing trust and ask for help when they couldn't before. Families say they don't feel alone anymore, especially Black and brown communities. As all of this make me see the collective power of institutions working with the community, that's the only way we can make the change. This community was one of the most affected by the pandemic. Gage Park, along with other Southwest Side neighborhoods, are the home of too many essential workers who don't have the choice to work from home. Many of these parents in these homes are the sole providers. Many of these parents also are contracting the virus at work and bringing home. We know in these neighborhoods our Black and brown communities reside, there is so much risk just living here. Protect Chicago Plus is our chance to ensure Gage Park and other neighborhood communities who are being hit by the virus are able to decrease our risk and have access to the resources that we deserve. I'm also one of the members of the team of the COVID Rapid Response, and I feel safe. I already received my second dose of vaccine, and my hand is still working in Say Hello, and helping delivering the food to our communities, those who are quarantined. Thank you for all the support you're giving to those, but also we want to continue working together to ensure our community receive all the resources that we need. Thank you.
Thank you, Elidet. You see what I mean? Next, I would like to introduce Dr. George Miller, the President and CEO of Loreto Hospital.
Thank you very much, and to Mayor Lightfoot and Dr. Awadi, it's a pleasure for me to be here today. The mayor teased me about being from Texas. On Monday, my car turned left and tried to go back to Texas. Yesterday, it looked at me and said, "Thank God I live in Chicago now." So, I wanted to take just a few minutes to share the success that we've had with the partnership with the city at the Loreto Hospital. As you may know, the mayor and Dr. Awadi chose us to receive the first and administer the first vaccination in the city of Chicago. From that, the next day, we were contacted by CNN, and both my chief operating officer and I received the vaccination live on CNN the very next day. From that, we have 550 team members at the Loreto Hospital, 530 of them, more than 90%, mostly African-American workers at the Loreto Hospital received the vaccination. And we did it by having town hall meetings, one-on-one sessions, and we convinced people this is safe and effective. In fact, the major reason, Mayor, that most of our team members took it because they saw me take it live on TV, and they noticed that I didn't grow a third eye, and they felt it was safe. But it was the conversations we had from that. But what I'm here to share with you, that our success in 2.5 weeks, we've seen over 6,211 of our community members have gotten the vaccination. And the joy and the thrill of giving life-saving vaccination, and talk about equity, 76% of them are black and brown, higher than the city of Chicago, because we've reached out to the community. We've gone to churches, to schools, to community organizations, the 15th precinct of the Chicago Police Department. And they came in and we gave them the vaccinations. Today, we're going to Malcolm X College for their essential workers who work in healthcare and nursing, respiratory therapy, pharmacy, and others of their school. So we've gone outside of the building to do vaccinations as well as inside. Our original plan was to do 180 a day at the Loreto Hospital. Yesterday we did 335. Today we'll do another 335 plus at Malcolm X College. And Mayor, my team members, and Dr. Awadi, my team members wanted me to let you know they're willing to stay until 11 o'clock at night and be there 7 days a week because of the thrill and joy of giving life-saving vaccinations to the community and making a difference. It is outstanding. So we're prepared to go around the clock, quite frankly, especially dealing with what you talked about, the equity. And here's one example of why they're so proud. I received this letter. Dear Mr. Miller, it was a pleasure to meet you earlier today in the midst of the COVID-19 vaccinations at the Loreto Hospital. Seeing a senior executive on the front lines, encouraging the staff and welcoming the public is a very confidence-building experience for everyone. Leadership is as leadership does. Thank you for being there and have your leadership. My wife, Marcia, and I were very favorably impressed by the organization, the professionalism, the patience, the kindness, and good cheer with which your team are carrying out their complex, challenging tasks. We received our vaccinations without any difficulties and are looking forward to returning in 3 weeks to receive our second dose. as an expression of our appreciation and gratitude for this work that you're doing in our community and your colleagues, we're enclosing a check. Mayor, another check has come in, and it's great because they were very impressed with what your leadership has done by making this vaccination available for the communities that are vulnerable, that have disproportionate numbers in the COVID vaccination. And finally, I want to thank both Dr. Arwady and Dr. Robinson, who always takes our call. We can do much more if we had more vaccinations, but I certainly understand the challenge of that. But we're willing and able to do this job 7 days a week, as many hours a day as possible. Our team members are thrilled. They get great joy out giving those vaccinations. They understand our mission very, very well, and we want to thank the mayor and Dr. Arwady for the great work. Thank you.
Thank you, Mr. Miller. With that, I would like to introduce Alderman Coleman, who has the most amazing hat on. Welcome.
Good morning. Good morning. I am Alderman Stephanie Coleman, and I would like to say welcome to the 16th Ward. The 16th Ward is made up of Inglewood, Chicago Lawn, Gage Park, and back of the yards. I have to commend not only Dr. Arwady, but our illustrious mayor, who has reinforced and made a commitment to serving the least of these. Thank you for serving the Black and brown community and recognizing the disproportionate of not only health care, but other challenges that not only our city face, but especially our communities on the southwest side. Some 8 months ago, Dr. Miller, before the 19 inches of snow, we would be out in this very parking lot partnering with organizations like Ombudsman School that is right next door, our Neighborhood Promise, SWAP, Greater Southwest Development Corporation to do COVID testing in this parking lot. So the Southwest Sider in me is not only happy, but the alderman in me is proud that a vacant building is now the caveat to saving lives with this initiative, Protect Chicago Plus. And thank you, Mayor Lightfoot, for your commitment in serving our community. That's due for a round of applause. I would like to especially thank our essential workers, our men and women who are the segue to life and healing in our community. And I am committed to bringing, as a family, my 87-year-old father who has not left home since March 12th, my newly senior citizen mother who's 65, and my only surviving aunt and uncle. And we as a family are going to get our vaccination together in the 16th Ward, and now we have some place to come. I'd also, I'm going to use my daughter privileges if they're watching, and I'd also would like to thank and impress and challenge and encourage everyone to please do your due diligence, do your research, and bring your family. Make this a family affair. There is unity in our community, and it takes partnerships with Esperanza, Loretta Hospital, our CDPH, and Mayor Lori Lightfoot, and the 50 wonderful city council members, and improving and making Chicago the wonderful city that we know it to be. God bless you all, and thank you for coming to the 16th Ward.
Well, it's hard to follow Alderman Coleman's incredible enthusiasm, but I want to lift up one of the things that she said. Do make this a family event. The fact that you are taking your parents, your beloved aunt, we've seen that happen in other areas across the city, and it's a beautiful thing. I also want to do two more things before I'm happy to take your questions. The fact that 90% of the workers at the Loretto Hospital have now gotten at least a first dose is a remarkable statement. I know from talking to CEO Miller that there was a lot of hard work that went into getting that incredible achievement. A lot of one-on-one conversations to break through the reluctance and the fear that people had, even in the midst of this pandemic, about taking a life-saving vaccine. So, George, I just want to say hats off to you, your whole team. It's a remarkable achievement, and I issue a challenge to other employers across the city. Follow the lead of the Loretto Hospital and make sure that your employees get offered this life-saving vaccine. Last thing I'll say, and then we'll take your questions. I also want to give a shout out to the team at the Vaccine Operations Center, led by Tamara Mahal, who's here. Tamara, wave your hand. These are the folks behind the scenes that are getting it done. They are working tirelessly to break through any logistical challenges. They're meeting with folks. They're opening up opportunities all across the city. This would not be happening. We would not have the achievement that we're talking about today without the hard work of Tamara and her team. And I just want to say thank you on behalf of a grateful city. And with that, I'm happy to take your questions.
I'm not sure you'll be happy to take my questions when you realize all that I've got.
Well, I was faking it a little bit, Greg.
Okay. Well, let's start with on topic, please. And I
Sure.
have a number of questions, and these were actually directed for Dr. Arwad, if we could, just about the vaccination delays and whatnot. Can you clarify just what has happened? You said 6% doses down. You said you were talking about the weather and everything. What have been the delays, and could anything have been done to avoid or otherwise mitigate the delays?
We can control a lot of things, but we can't control the weather. And as I explained earlier, as one of the Midwest sites, our vaccine gets shipped by truck from the Midwest distribution centers, which are in Tennessee and Kentucky. And Tennessee and Kentucky have been hit hard, like Chicago has, but they don't have all of the infrastructure that we have here to be able to do all of the snow clearing and all of those issues. So typically here in Chicago, we get most of our vaccine, not just the city, but all of our partners receive it typically early in the week, Monday, Tuesday, sometimes it'll lag into Wednesday. We saw delays in both our Pfizer and Moderna arrivals. Lots of work, certainly, and there were, really at the national level, they worked first to make sure these would become overnight deliveries, and first in terms of our orders, we're the first out. City of Chicago works hard to make sure we've always got the first orders in. We got people who stay late and get that in. And so I am happy to say that as of yesterday, all of the city's Pfizer doses had arrived, either at the central city location or at any of our partners that receive Pfizer. Moderna was more delayed, but we expect, per what is in the computer, 117 out of the 120 sites that we expect to receive Moderna for it to arrive today. So we really, as of yesterday, had cleared Pfizer, and as of today, expect to clear Moderna. And I want to just make sure people understand that it is not that we stopped vaccinating. We have second doses, we have other things that are in place. And I pulled, for example, even earlier this week, on Monday, we did more than 8,000 vaccines across the city. On Tuesday, more than 8,000. By Wednesday, as Pfizer started to get here, more than 11,000. That is about half of what we would typically do. But we're back on track. There's really nothing that we could do differently, but the team behind the scenes has been working hard to make sure that we push things out as quickly as we get them here and try to be in communication.
For those who were delayed in getting their second dose, what impact does that have if you don't get it within the scheduled time frame?
Yeah, so the CDC says you can get a second dose of either the Pfizer or the Moderna vaccine up to 6 weeks after the time that second dose is scheduled without any concerns related to efficacy or to a need to reschedule. That said, I do want to just re-emphasize that we want people, when there's not a snowstorm going on, getting the second dose on time at the same location where you got that first dose typically, because we deliver those second doses following on 3 or 4 weeks after the first dose. So we encourage people to get the vaccine on time, but if something intervenes like a snowstorm, not a concern. All those people are having all of their doses rescheduled, and everybody will get it certainly before 6 weeks. I would guess most will get it within a week.
Mayor, there's a ton of off-topic questions, if we could. First of all, one of the big questions has to do with the Inspector General's report about the George Floyd rioting and everything from last summer. Bill Cameron asked, what action are you planning in the wake of this report on how police handle everything?
Well, I think that, it's important to remember a couple of things. The report focused on a time period at the end of May into the first couple weeks of June. We're now 6-7 months removed from that time. And I think that's important to keep in mind for the following reason. The Chicago Police Department obviously took a deep look at what happened over the course of that time period. All of us, and by that I mean not just the city of Chicago, but really across the country, prepared for large-scale but peaceful protest. What we saw play out here in Chicago and really across the country was something very different. We saw peaceful protest, to be sure, but in almost every occasion, particularly when there were large gatherings, that protest got hijacked by agitators who came to fight the police. And that is well documented. It was well documented contemporaneously. And at the same time, what we also saw is criminal networks who took advantage of the opportunity to engage in robbery and systematic looting. The police department, I think, learned a lot from that experience and put that learning into practice over the course of the summer and the fall and currently. As you know, for example, there was a lot of tabletop and live exercises that were done to better coordinate communications and the timeliness of response to large-scale efforts. That manifested itself in, I think, a very peaceful fall, particularly around the federal election, looking at what Black Friday after Thanksgiving and New Year's Eve and other potential threats that came to our city, but were handled as a result of the lessons learned from the incident that happened at the end of May and into June. So, yes, there were some challenges, no question. The police department, I think, has owned that responsibility in its own after-action report, which it put out 2 to 3 weeks ago before the Inspector General. We had cooperated with the Inspector General. The monitor, we expect to put out her after-action report as well. But as I said, I think there's a lot of learning that went into what happened across Chicago, but across the country. No mayor that I've talked to, whether New York or LA or Seattle or DC, Atlanta, Denver, and the list goes on, expected what we all got, which was this massive civic uprising followed by agitators who came to create chaos and fight the police, and professional robbery crews that robbed stores and small businesses and engaged in looting. But having been through that experience, which the city of Chicago certainly hadn't seen, if ever, not since the 60s following the assassination of Martin Luther King, we are, I think, better poised to be able to respond to any issue that arises. And again, I think we demonstrated that, particularly in our preparations to keep the city safe and peaceful during the federal election in November.
A couple of questions from my colleagues just about responsibility. What responsibility do you bear for the city not being prepared? What responsibility does David Brown bear for that? And do you still have confidence in David Brown's ability to lead the department?
I have 1,000% confidence in David Brown's ability. In my time thinking about policing in a city which goes back about 20 years, I can't think of another leader who said, let's look at what happened, what went right, what the challenges were, and then we're going to put it out for the public to review it. That's David Brown's leadership. And I think it says a lot about the integrity and legitimacy that he brings to the job. Look, as I said, we got what I hope is a once-in-a-lifetime experience in the way in which the indignation, and rightfully so, following the murder of George Floyd played out in cities all across the country. And we've learned a lot from that experience. We've demanded more of ourselves, and we'll continue to do that.
A couple of just follow-ups on that. Can you clarify, there were some reports that indicated you rejected the offer of the National Guard early on.
That's completely untrue.
Not true.
Look, I'm a kid who grew up in Ohio, down the road from Kent State. My earliest memories are very seared by the then Ohio governor calling in the National Guard to Kent State, and the result was 4 students dead. Calling in the National Guard is a very serious matter, one that I did not take lightly. Over the course of that Saturday, a lot of conversations about how we were responding, what additional resources we need, and through that very long day, had a lot of conversations with the superintendent, and we made a determination that we needed some additional resources, and within moments of making that determination, I reached out to the governor. It was late at night on that Saturday, and the governor was incredibly responsive, and we started the process to bring the National Guard to our city, and they arrived, the first tranche of them, within about 24 hours on that Sunday. So there was never a time that it was offered and we rejected it. That's simply not true. I don't even know where that came from, because that's not true, certainly in my knowledge. And the first conversation I ever had with anybody from the state about the National Guard is when I called the governor myself that Saturday night.
One of the other issues that came out of that report was the issue of raising the bridges. Was raising the bridges a bad decision, and will you rule out using that tactic in the future because of the criticism of it?
Look, whenever you do something that disrupts transportation, it's a very big deal, and I don't take that lightly. But in that circumstance where we were trying to make sure that police could adequately respond to this massive crowd and the violence that was happening, raising the bridges was absolutely the right decision. We're going to take this on a case-by-case basis. We won't say categorically we'll do it every time, because it doesn't make sense to do it every time. But if there's a need and that need is justified, I'm not going to hesitate to use any tool that is necessary to keep our residents and our businesses safe.
On the issue of civilian oversight of police, one of the questions was, why did you ask Chris Taliaferro to put off the hearing today on the 2 proposals that have been out there for a long time? And how much credibility do you expect this seeming to be last-minute one coming from you?
Well, let me be clear, okay? In 2016, I led the Police Accountability Task Force. If you look at that report, in that report was a recommendation regarding civilian oversight. There's nothing last minute about my involvement in this work. We will put together a proposal. We've been doing a lot of listening from all sides, including the GAPA folks, including others who have come to the table about civilian oversight. But civilian oversight is something that I started the conversation in this city about almost 5 years ago.
How will your plan look different than the ones that are out there?
Well, you'll have to wait and see.
I mean, can you?
You'll have to wait and see.
And when do you expect to announce that? Soon? Are we talking next week soon?
Soon, sir.
Soon. All right, let me scroll through here, 16,000 pages of questions. There's a follow-up one. Mariana Aaron asked this, coming from a teacher. CPS teacher, clinician, they're required to be in schools, but management is home. How do you manage a building from at home? And if you can sort of address any concerns you might have about
I don't think that's true. I talked to members of the senior leadership team. I think Dr. Jackson and Chief McDade, a number of the senior managers are in their offices every single day. So I think the thing that we need to focus on is making sure that we're present in schools for in-person learning so that our kids have the opportunity that they need to grow and thrive.
How do you respond to complaints about your decision to spend $281 million of the federal stimulus funds on police personnel costs?
I got to tell you, criticism comes with the job of mayor, but this one's just dumb. And here's why. We had this once in a lifetime experience of COVID-19. It was not part of our budgeting that was passed in the fall of 2019 because we didn't understand that we were going to be facing the kind of pandemic and challenges that we face. So the federal government came to cities like Chicago and said, we will provide you with reimbursable funds for monies that were spent in response to COVID-19. So we saved taxpayers hundreds of millions of dollars by saying yes to the federal government. So should we have said no? No. federal government. We'll incur this expense. We'll put this burden entirely on City of Chicago taxpayers, and you can take your money elsewhere. That would be foolish, and of course we didn't do that. The federal government, through the CARES Act funding, gave us the opportunity to seek reimbursement for the expenses related to COVID-19 response, whether it was law enforcement, whether it was CDPH funds, and of course, on behalf of taxpayers in the City of Chicago, we took advantage of that and used those monies so that it didn't result in an even further deficit that would have been borne by our taxpayers. So again, criticism comes with the territory, but this is one that to me is a total head scratcher. When we saved Chicago taxpayers hundreds of millions of dollars.
If I can just circle back one more to the civilian oversight. One of the questions was, do you believe you're going to have enough votes for the proposal you're going to put forward? Because it seems like GAPA and CPAC have now sort of combined forces and they believe they have enough to support their version.
Well, I do a lot of talking to aldermen. I feel very confident about where those proposals lie. I have a pretty good sense of what's going to happen there. So we'll see. We're going to put out our proposal, which borrows from, I think, the best that we've seen here and across the country, and it'll be what it's going to be. But I feel as I have for the last 5+ years, when this conversation really took hold here in the City of Chicago, there's an appropriate role for civilian oversight. Obviously, a lot of circumstances have changed. We're now under consent decree, and we've got to accommodate that reality in the oversight. But I feel confident that we'll be able to get something done.
Last one from maybe Jacobson. She asked, with carjackings up 283%, 83 Chicago teenagers murdered since being locked out of school, what is the timeline for reopening high schools for Chicago students?
So let's put aside the false facts in the lead up to the question. High schoolers have not been locked out of school. They've been learning remotely. But we're working on a proposal, as we indicated when we reached an agreement with the Chicago Teachers Union. There's a joint committee that will be meeting to discuss high school. CPS, I believe, reached out to the Chicago Teachers Union to start that process just yesterday, and I'm anxious for that to get underway so we can get our high schoolers back in school before the end of the year.
Okay.
Thank you.
Thank you.